Thank you. This is a really important crisis, and I want to just say one quick word about it. That thank God we are viewing the opioid crisis as a public health crisis. We ought to learn from that and view every drug addiction crisis, whether it happens primarily to white folks, black folks, or brown folks, or anybody else, as a public health crisis which requires a public health solution. So on the opioid crisis, we need to make sure we have adequate funding for addiction treatment. We need to make sure we have adequate funding for prevention. We need to make sure that funding is available in schools and in community centers, and we have to make sure that it's universally available. By the way, I know this sounds a little surprising, but we need to legalize the recreational use of cannabis, which has been correlated in states that have done this with a decline in the opioid crisis, which is part of why the pharmaceutical industry is opposing legalization of cannabis. And we have to do all of this in a totally universal way, understanding that the opioid crisis affects communities most in areas of high poverty, and a place where healthcare access and mental health access and substance abuse treatment access varies from place to place, is an option or a privilege and not a right, is a place where we're not tackling the problem. And that's why I believe that healthcare is a right and not a privilege or an option, and that's why I'm fighting for universal single-payer healthcare as the mechanism to pay for these solutions.